Good evening, Mr. Sonani. I can see you are having abdominal pain. Can you tell me about?
Look, I know what you are thinking, okay? It's Priyansh again. But this is different, okay? The pain is real. It is not in my head like everyone think it is.
Okay, Mr. Sonani. I can see you are in distress. Can you tell me about your pain? How is your pain overall? Where is your pain? Abdominal
Oh,
pain?
sure, like you actually care. The last doctor barely looked at me for 2 minutes before saying it was probably due to stress and sent me home with Tinolol. I have been to 4 different doctors in the past month and nobody listens to me.
Mr. Sonani, I hear you saying that you feel dismissed and no one is actually believing you. But it must be feel isolating for you. But I'm here to help you out with your abdominal pain and I will listen to your concern seriously.
Easy to say for you. Do you know what it's like to be in pain and everyone thinks you are crazy and everyone thinks that you are making it up for attention?
No, I don't know how that personally feels like you, but I can imagine that you are having a you are having painful. On the top of you are experiencing physical pain. Can you tell me more about your isolation? How does this isolation feels for you?
You know, I feel like I'm completely alone. Even my family is starting to think I am making it up because I have been to so many doctors. But what am I supposed to do? Suffer in silence?
You shouldn't have to suffer in silence, or you shouldn't have to fight to be heard. Now, may I know how is your abdominal pain is different from the previous abdominal pain you are experiencing?
Okay, it started 3 days ago. Sharp stabbing pain in my lower right side. It constant now, it getting worse, and when I move or cough, I never had experienced this type of pain before.
Thank you for those details. That helps me understand what you are experiencing. Okay, Mr. Sonani, I want to be honest with you about something. I can see from your chart that you have visited here several times recently. That might be next staff to be prejudge you.
So you are looking at me like I'm a frequent drug seeker.
Actually, what I see is someone who is seeking help persistently because they are feeling symptoms, and that symptoms may be affecting their life. It takes courage and especially when no one is hearing you or no one is supporting your concerns.
I didn't expect you to say that.
I'm wondering if underneath all this anger and frustration you might be scared of what's happening inside your body.
Yes, I'm terrified that something serious is wrong, and by the time someone believes me, it will be too late. I lost my mother 2 years ago to cancer that wasn't caught early because the doctor kept saying her symptoms were of anxiety.
Oh, I'm so sorry about your mother. That loss combined with your current situation and feeling of dismiss, that might be bringing up lots of fear for you to by ignorance by the medical system just felt she like was having.
Exactly. What if I have what she had, and what if everyone keeps ignoring me until it's too late?
Mr. Sonani, thank you for sharing that with me. Now I understand why is it important for you to be heard and to be taken seriously. Let me explain what I'm thinking we should do. Your description of pain, location and the way it's versions with the moment. These are the symptoms I want to be investigating thoroughly.
You mean you actually believe there's something wrong with me?
I believe you are experiencing real pain that might be requiring real workup. I'm going to examine you carefully, and I think we should get some blood workup and the imaging to rule out the condition like appendicitis and the other abdominal issues.
So you are not just going to send me home with pain pills and tell me to see my primary doctor?
No, based on what you have told me, this warrants immediate attention. Here's what we're going to do first. First, I'll do the physical examination. Then we'll get a CBC, metabolic panel, and after that we go to CT scan for your abdomen. While we wait for the result, I'll make sure that you are comfortable.
Thank you, doctor. I am sorry I was so angry when I came in. I just felt like I had to fight to be heard.
You don't need to apologize for advocating yourself. Your anger makes complete sense given what you have been through. I want to work with you, not against with you. We get this test done and figure out what causing you pain. Let's talk about how can we improve your overall experience with the healthcare.
What do you mean?
Frequent symptoms can sometimes be a sign that we need to look at the bigger picture, both emotionally and physically. Would you be open to discuss a more coordinated approach to your healthcare?
Yes, I just want to feel better and not have to fight for care every time.
That's exactly what we want to. Let me start with your physical examination, and then we'll go get the test orders. I'm going to document everything that we have discussed during our session today. That might be helpful for the future provider to understand your history and the concern for the better.
Thank you, Dr. Prince. I haven't felt this hurt in months.
Yeah, you deserve to be heard, Mr. Sohani. Let's work together to get your care what you need. Okay, I'll be back with the nurse. Then we'll do our physical examination and the test what we have to do.